Good morning, students. I'm Dr. Kanika Bhalla, and I'm delivering a lecture on forensic odontology today. Welcome all. So, what is forensic odontology? Forensic odontology or forensic dentistry is basically that branch of dentistry which is in the interest of justice. It deals with proper handling and examination of dental evidence with proper evaluation and presentation of the dental findings. So, here comes the role of dentistry in forensic plus legalities that we need to concerned with. The importance of forensic lies in a lot of manners in our life. Like we need to identify the unknown human remains in the postpartum dental evidences. Then we need to assist a scene in case of mass disasters. If there are cases of mass fire or there are floods, then we need to recognize the body, and there comes the role of forensics. We need to identify the sex, whether it's a male or a female. We need to estimate the age of the dead. Could be living also, it could be a child, it can be any age group person. Then we need to present all those evidence in the court of law, and that court of law actually is important because forensic deals with the legalities. Now, why is teeth important? Why teeth? Forensic medicine is there, but why teeth? Teeth are those parts of your body which are most hard and most resistant in any extreme conditions. Our dentition is very unique to every individual, and that is why it holds a lot of importance. You may see millions of individuals, but not even a single human being will have exactly the same dentition as the other person. So dentition is very unique to a person. That is number one, and that is why it holds a responsibility and importance in recognizing an individual. Then it can resist extreme conditions because of the very resistant enamel layer over the dentine. It can resist up to the temperatures more than 100 degrees. Any kind of mass disasters, the teeth will always remain intact. Then the third point is that they are an excellent source of DNA. There might be possibilities when the hair, the other body structures are totally deformed in case of fire. There the teeth are remain, and they are important sources of DNA. So we can extract DNA from the decomposed and the burnt bodies, and that is why teeth hold very important role in forensic dentistry. Now, where comes our role as dentists in forensic dentistry? One is a forensic odontologist, but we are dentists, right? We are important because we maintain our dental records. Every dentist, be it a private practitioner or be it in any academic college or any institution, we hold an important responsibility of maintaining our dental records. Because if we do not have the ante-mortem records, the post-mortem records is of no use because they cannot be compared to recognize an individual. So our role as a dentist comes in maintaining the dental records, and there are various ways where we can maintain and keep the dental data in the form of dental charts. There are radiographs, there are dental casts, the models, there are photographs of the pre and the post. So we have dental charts where we just for the entire dentition we mark whether which tooth is restored or which tooth is missing, or if there is any prosthesis, or if there is any particular anomaly. So all these, and if we have the cast models of those impressions, then we know that this particular data belongs to this individual. And the x-rays we have during normal routine procedures, when you do your patients, you do their x-rays. So if you have maintained the records of the patients, we actually hold this moral responsibility and the ethical responsibility to maintain the dental records as dentists. Now, how do you compare the post-mortem and the ante-mortem records? Post-mortem record has a post-mortem unit, a proper unit. In case of any mass disaster, the dental examination has to be done on the crime scene. But this procedure is done after the procedures such as autopsy and when the medical team is done with. Once the entire crime scene has been totally supervised and the fingerprinting and the photography has been taken by the medical team and the autopsy has been done, then the dental examination starts. So we need to carry a portable dental radiography apparatus with us because you need to take the radiographs. We need to arrange for the photography also, the proper cameras. Then if we have to extract the teeth or any specimen from the orofacial structures, we need to get them labeled properly. So we need to have those bottles in the, where we can take the specimens and we can labeling. So all these apparatus should be very handy with us when we go for a post-mortem unit. And once we have collected all the records, then comes the role of the ante-mortem unit. And this is a very difficult task. Why it is difficult? Because in a population in a country like ours, it can be challenging to just locate the dentist, and for the dentist to locate the records, and it can be 10 years back or 15 years back. So this requires an extensive network of communication. So it involves the police, the relatives of the victim, the victim's dentist. So if the entire channel goes through a proper procedure, and the police reaches us to a dentist, the victim's dentist, and if the records are not available with us, it is very disappointing, and it ethically also is not right. So then the dentist is requested to provide any kind of record, whether you have the photographs of the patient, any cast, or any models that we have. So then you have it, and there you compare the ante-mortem and the post-mortem, and it helps in the identification of the individual. Now there are various modes of identification, like we have DNA extraction, we have palatal rugae pattern study, which is called rugoscopy or palatoscopy. We have lip prints analysis, which is called as chiloscopy. We have bite marks analysis, and then we have dental age estimation. There are various modes. Palatoscopy or rugoscopy we'll start with first. Rugoscopy or palatoscopy is basically the study of the palatal rugae. Now in our maxillary dentition, the palate consists of a lot of asymmetrical irregular ridges on the anterior part of the palatal mucosa. These are called as palatal rugae. Now these palatal rugae are very well protected by the lips, the cheeks, the teeth, and even the buccal fat pad. And so if at all, why it holds importance, that if at all there are cases of fire and high impact trauma, suppose there's a massive trauma and there's an impact on the face, the palatal rugae, since they're bound first by the teeth, maxillary teeth, and then further by your lips and your buccal mucosa, there are chances that they will get hit last and even burnt last. So there are chances that they will be protected even in the worst case scenario. So that is why palatoscopy holds an importance in forensic dentistry. Secondly, the rugae patterns are very unique to any individual. So just like teeth, the rugae patterns are also very unique to any individual. They seldom change with age. There are certain patterns in palatal rugae that a child is born with, and those patterns rarely change with age unless there is a proper surgical trauma, any surgery that has been done, or any pathology that has been done. Otherwise, palatal rugae pattern are very unique to any individual, and they do not change with age. And secondly, even if there is a trauma and there is any surgical procedure, they reappear. So palatal rugae, they reappear. So that is why palatal rugae are protected by a lot of structures. They are unique to an individual. They do not change with age, and they reappear after any trauma or any procedure. That is why rugoscopy is important in forensic dentistry. Now there are certain classifications that have been given, that how do we depict and how do we denote that which pattern it is. So if we start from the medial side and we move towards the lateral terminal, the first classification, the simple one, says that they can be classified into primary, secondary, and fragmentary. So primary rugae patterns are the ones which measure more than 5 millimeters. The secondary ones are the ones which measure between 3 to 5 millimeters. The fragmentary are the ones which is between 2 to 3, and less than 2 millimeter we do not consider. So based on the length of individual rugae, they have been classified into primary, secondary, and fragmentary. Less than 2 we do not consider. 2 to 3 are fragmentary because they are small fragments. 3 to 5 millimeters is secondary, and more than 5 are the primary rugae. So this is one classification. But another classification which has been universally and widely accepted is based on the shape of those patterns. So they have been divided into curved, if they are curvy in nature; if they are irregular, they are irregular patterns; if they are straight, if they are wavy, they are forked; if there are diversions, then they're forked; and an island, like very small islands. So this classification that has been widely accepted is the based on the shape. The earlier one was on the based on the size. So it can be either curved, they can be irregular, they can be straight, wavy, they can be forked and island. So based on these patterns, we take the cast. Now how do we do palliatoscopy? It's a very simple procedure but very technique sensitive. We take the cast of the patient. See, if we have the ante-mortem record, we have the cast and the study model with it. But for the post-mortem record, if the victim is live, if the victim is dead, there might be a possibility we can take it, there might be a possibility we might not take the impression. So if we take the impression and we get to receive that post-mortem from the cast, and we compare both the cast together using a software or even the visual examination, and they are just simultaneously lying one over the other, we identify. Palliatoscopy has another advantage. We have, if in case of a lost edentulous patient where the patient is either old or if they lost all the teeth, then what happens? Because there are no teeth because of trauma and the patient is old, palatal rugae are still there. So for edentulous patient, we have palatal rugae pattern, and it helps us to identify the patient. Then second procedure is the lip print analysis or cheloscopy. Now cheloscopy is a very technique sensitive procedure, but it is unique to every individual. Again, why? Because our lips have a lot of wrinkles and grooves on it, and these wrinkles and grooves are also very unique to any individual, just like palatal rugae pattern. And second thing is that they are heritable. You might have the same set of lip print pattern just like your mother or father, so they're inherited. So that also gives a hint about an individual, if you have to just check whether they're the same set of family, and then they're individualistic, of course. Then comes the classification of lip prints. Now the most accepted classification in cheloscopy is given by Shushi Hashi. He divided the lip prints into 6 types, type 1 to type 5 types, sorry. Now type 1 is the one where the lips are just falling straight, the grooves are absolutely vertical. Then the type 2 is the one where they are branched. Group 3 is the one where they're intersected, they're cross sections. Group 4 is the reticular pattern, it's like a meshwork, like a check meshwork. And group 5 is the one where the grooves are not identified morphologically into any typical type, it's just a random pattern. So type 1 are the clear-cut vertical grooves, type 2 is the branched one, type 3 is the intersected grooves, they're intersected, type 4 is the reticular where there's a meshwork, and type 5 is morphologically undifferentiated type. So the procedure for lip printing is that you take the individual, it can be living or the dead, the lips have to be cleaned. You apply any dark colored lipstick on the lips with the help of a paint. Please make sure that you do not apply the lipstick directly, because then it can just transfer the epithelial cells from the lip to another and the entire procedure fails. So the paint brush, the lip painting brush has to be sterilized. You apply the lipstick over the lips, and you make sure that you cover the vermilion border properly. So once you've applied, and make sure that it is a dark colored lipstick, right? So you have painted the lips properly. Then you take a transparent cellophane which is sticky from one side and not the other, and you just paste that cellophane properly over the lips, and you carefully remove that and you paste that cellophane tape over the plain sheet of paper. Now why is it technique sensitive is, first, while you're applying lipstick, you should make sure first that it is absolutely clean. The sterilization have to be maintained so that there is no transfer of epithelial cells of the other patient. Second, you have to be very clear that while you're applying it, it doesn't have to be very dark so that it is very patchy, and you don't have to put it very light so that the color does not come. So you have to apply just the apt amount. And the third thing is that while you just put the cellophane on the lips, you don't have to push it too hard so that it doesn't smudge. You just take the cellophane off very delicately and put it cleanly over the paper so that no folds come, no smudging comes. That is why cheloscopy is little technique sensitive, and that is one of the drawbacks of this technique. and that helps you in identify the individual. So where there are a lot of crime scenes where you see the lipstick prints on a glass of a wine glass or any glass. So there you can just compare that whether the same lip prints are there, and the role of cheloscopy comes into play. Then there is identification from dental DNA. Now teeth can resist extreme condition, as we know, and they are an excellent source of DNA. So the technique that we apply is a polymerase chain reaction, which is where we amplify the degraded DNA. So the advantage is the DNA can be compared to the parents or the siblings who are alive, and it felicitates the positive identification. So we have two types of DNA, a nuclear DNA which is present in the nucleus, and we have a mitochondrial DNA which is present in the mitochondria of the cell. Now the extraction of this DNA can be done in various ways. So you know that the pulp is basically gives the vitality to a tooth, and pulp is the main powerhouse of the tooth, just like the mitochondria of the cell. So pulp contains all the blood vessels, all the nerves, and the DNA. So you need to extract the pulp, and the technique is that you cool down the entire tooth to extremely low temperature using liquid nitrogen. Then you just mechanically grind the teeth, and the sufficient amount of DNA can be extracted. The disadvantage is that the teeth may get, the teeth needs to be completely crushed. So you cannot have the tooth sample with you. And after the destruction, you extract the DNA from that powder. The second technique is the easier one, that you open the root canals, you scrape off, either the pulp is there, the chances are that it won't be there, so you just scrape off the pulp area, the entire pulpal area inside the root canal. You scrape off that pulp area, and you just flush off the debris, and then you retain the morphology of the tooth. That is an advantage, and it is an easier way. So there you are grinding the tooth, but here you have retained the tooth also, and you have extracted the pulpal scrapings and extracted the DNA. So you have the DNA as well as you have the tooth also for identification. That's the advantage of the second technique. Now the fourth one was the bite marks. We have done cheloscopy, we have done rugoscopy, we have done dental DNA extraction. Now comes to bite marks. Now bite marks is another important technique, and it is very elaborate. There are various classification, Cameron's, McDonald's and Webster's classification, where we need to see that whether the tooth, we need to see whether there is, when we see the bite marks, there is a pressure on the tooth, there is tongue pressure on the tooth, and there are scrapings of the bite marks. So when there is enough pressure, you need to, when sufficient amount of pressure is applied on the tooth, the tongue is pressed against the ridges and the lingual surface, that gives another kind of bite impression. The third type is the tooth scraping. These are the marks which is due to the scraping of the tooth against the tooth marks. So type 1, 2 and 3 is dependent on whether there is only the bite mark, whether there is the pressure along with the tongue also, and the third is where the scrapings are also present. So there's another classification given by Webster's, where it says that whether for example, it's a hard chocolate, so the food item just breaks fractures readily. So there you will get the tooth penetration marks. The fracture of the fragment of the tooth item is considerable. The second part is where, for example, there's an egg bite, where the fragment of the tooth bite is, so you will see more of a tooth mark. When it comes to a hard, like a chocolate, a hard item, the bite marks are superficial. But when it comes to a softer ones like egg bite or an apple bite, the amount of bite mark is more evident. And the third type is when the bite mark is on a very soft food debris like a banana. So you will see the complete penetration of the teeth, and you will get to see the proper bite marks. So bite marks in forensic odontology makes important role when food items are involved, and when there are sexual harassments. The common sites are seen like on the breast of a female, on the thighs, on the shoulder, and on the males there can be children also in the abuse. So bite marks on the type of the amount of penetration and the amount of pressure applied. You will see that what other kinds of bite marks they are seen. Then the last, after the bite marks, we will come on to the dental age estimation. Dental age estimation is basically important when it comes to children also, because children have a very peculiar dentition. They have a mixed dentition, and their age of eruption of teeth and their age of shedding of the teeth is very much said. Even when you play a role as a dentist in your own clinic, even before a parent tells you the age of the child, seeing the dentition, you can estimate the age of the child. So age estimation in case of the infants, age estimation in case of children, and age estimation in case of adults is all important. Now in case of infants, why we need to play a role of an infant is that the neonatal line plays a role. The neonatal line is the line where a child is born, and a physiological line is marked in, and it is seen in dental histology. So in case of female feticide, we see the neonatal line. Now if the neonatal line is present, that means the child was born alive. But if the neonatal line is not present, that means it was a feticide. In cases of children, we also estimate the age by various methods. The Staffson's method is the most important method which is used in. There's a formula by which you just estimate the age. So with all these methods, I conclude that forensic dentistry is an immensely important part of a dentist and odontology. All these methods play a very vital role, and we should all pay our equal contribution to the society and to the law of our country. Thank you, all of you. I'll sign off for this. Thank you.